Imagine you're on a shift and the patient says, "Doc, I can't breathe." Your mind starts racing. Is it their heart, their lungs, or is it something else? Don't panic. In this video, we'll break down a simple mental checklist so you can systematically rule out and rule in the most life-threatening and common causes of dyspnea. And a little gift for you: if you visit our website, visraverse.org, you can find this sketch for free. So grab it and follow along with us. Dyspnea, often called shortness of breath or air hunger, is the subjective sensation of uncomfortable, difficult, or labeled breathing. It is a symptom, it's not a disease itself. So there is tons of causes, tons of underlying diseases that will lead to this symptom. So imagine yourself waking up late, you're running to catch the bus, and you finally reach it somehow and you get into the bus. That feeling when you're running out of breath, the feeling of dyspnea is exactly this. You're short of breath. You can't easily breathe. So is this a thing that will make you come to the hospital? Of course, no. So the difference between this dyspnea and the pathologic dyspnea is that dyspnea happens either at rest or with much less effort than expected. So you walk for only, for instance, 2 meters and you feel that you're out of breath. For instance, I have a patient, she has scleroderma, it was diffuse scleroderma, and whenever she walks for like a couple of steps, she feels that she's out of breath. So this is dyspnea. So when we see such a patient, what are the things that are we gonna think about? Well, there are tons of cases, and this pyramid is going to help us have a general idea of what the patient could be having. These are the most common causes. Of course, dyspnea is a very broad topic and it has tons and tons of causes, but in this lecture, we're going to discuss the most important ones. So, we're going to start off with this needle, and we're going to know in a minute why I choose a needle for this row of the pyramid, but it's mostly either because of metabolic acidosis or respiratory alkalosis. So, for instance, you have an increase of acid in your blood. How are you going to compensate? Your body is going to compensate by increasing your heart rate. So you have hyperventilation and you feel that it's difficult to breathe. In the case of respiratory alkalosis, for instance, your respiratory rate is so high and your carbon dioxide is kicked out of your lungs, and therefore you have alkalosis. The next thing we're going to think of is the blood. And in this situation, we have low blood or bad blood. What do we mean by this? In the case of anemia, you have low blood, and therefore that leads to hyperventilation because your tissues are starving for oxygen. If you have bad blood, it could be carbon monoxide poisoning, or it could be methemoglobinemia. When we think of the heart, the most common cause is myocardial infarction, but there are other causes like congestive heart failure and arrhythmias. In the case of congestive heart failure, it's going to be a bit more obvious than others. So the patient presents with peripheral edema, jugular venous distension, and crackles if you do auscultation. When we think about the neuromuscular diseases, we want to keep in mind myasthenia gravis, Guillain-Barré syndrome, and amyotrophic lateral sclerosis. Then we got the big guy, the lungs. When we think about the lungs, there are tons and tons of causes. Let's start with these that cause both pleuritic pain as well as dyspnea. So we have the 5Ps: pneumonia, pneumothorax, pulmonary effusion, pulmonary embolism, and pulmonary cancer. Just a quick reminder, the parenchyma of the lung itself does not sense pain. The cause of the pain is going to be from the pleura. If you touch the pleura, you're going to feel the pain. Otherwise, you will not. We also have other causes like obstructive lung disease, including asthma and COPD, restrictive lung diseases, and diffuse alveolar hemorrhage. An interesting cause of diffuse alveolar hemorrhage that I encountered the other day while revising microbiology was Bacillus anthracis. So we have two forms of bacillus anthracis. One is the cutaneous, which is the most common form, and we also have the pulmonary. So in the pulmonary form, it's because of an inhaled animal hair that is already infected. So you're inhaling the spores, and that will lead to mediastinal hemorrhage as well as pulmonary hemorrhage. Like, this is not a thing that is really high yield to think of in this situation, but I just thought it's an interesting thing to mention. And the last cause we're going to mention in this video is acute respiratory distress syndrome. So, okay, we figured out all of these. So we thought about all of these differential diagnoses. What is the next thing that I'm going to do? The patient is waiting, and we want to exactly make sure what's going on with this patient. So the thing that we're going to do in this situation, the first thing, I'm going to order arterial blood gas. This is going to give me an idea about the acid base, about the electrolytes. Do we have metabolic acidosis? Do we have anemia, or is it a poisoning like carbon monoxide? And we're going to rule in or rule out all of these. The next thing I'm going to do is a chest x-ray. This is going to give us a fairly good look at the lungs. In some situations, like in COPD, for instance, we have hyperinflation of the lungs, especially in exacerbations. We can also tell if we have pneumonia, for instance. If we have lobar pneumonia, we can see that lobe on x-rays. If we have pneumothorax, we can also tell by looking at just chest x-ray. So it's not the perfect look, but it just gives us some idea of what's going on in the lungs. The next thing we're going to order is a 12 lead ECG. And that simply is going to help us rule out myocardial infarction and arrhythmias. One more thing that we can order, although it's not a standard, but you can order it in some situations if you suspect volume overload. BNP is produced by your heart cells, by the myocytes, is produced by the ventricles when we have volume overload. And this can give us some idea if we have, for instance, pulmonary embolism or congestive heart failure. All right, guys, that was the end of our lecture. If you find it helpful, please subscribe to our channel, give us a like, and comment down below.